Now for the latest on the coronavirus. Deaths in the U.S. have surpassed 140,000, accounting for almost a quarter of the world's COVID-19 fatalities. In an interview with Fox News yesterday, President Trump blamed the rise in positive cases to an increase in testing and said the spikes we're seeing are, quote, burning embers, and that the virus will simply disappear. He also said Dr. Fauci is, quote, a little bit of an alarmist, all while cases in several states, including Florida, Texas, and California, continue to rise. In fact, the LA mayor says the city is on the brink of new stay-at-home orders. Joining us now is Dr. Dara Kass, Yahoo medical contributor and Columbia University professor of emergency medicine. We're also joined by our editor-in-chief, Andy Serwer. Good morning to you both. Dr. Kass, I'm going to start with you. The president said that we have here in the U.S. one of the lowest mortality rates in the world. Does that really jive with the data that you're seeing?
It doesn't jive with the data that anybody has seen, actually. Unfortunately, it seems like, based on the interview yesterday, the president seems to be, honestly, sometimes making up information he wants to be true, and then asking people to find some study that maybe confirms. So he said, I think the mortality rate is probably like, we're doing good with 99.6%. Please get me the data to fix that. And that's just not true. We know that the mortality rate is probably between 3 and 4%, depending on which study and where we are with the virus. But it's just not nearly as magical thinking or rose-colored as a president would hope us to think.
Andy, the president said in his interview on Fox that we're testing for COVID more than ever, but that doesn't jibe with what you wrote over the weekend. You talked to a good number of folks. And the bottom line is, where the heck are the tests? What's taking so long to get them back?
Yeah, actually, the president's right. We are testing a lot more than we used to. We used to be testing 25,000 a day. We've gotten over 700,000 a day. The problem is it's not nearly enough. And so it's a misleading of him to say we're testing more, so we're done here. We need to test a whole heck of a lot more. You need to get the positive rate down below 5%, and we're way above 8 or 9% right now. That's what doctors will tell you. The testing situation is a mess, and basically because we don't have a coordinated federal response, and we've sort of left it at the hands of these two companies, LabCorp and Quest, with a bunch of other smaller players as well. It's just a complete mishmash. States are left to their own devices. Governors have to sort of figure things out. And, some places it's okay. Other places, in Arizona, you wait in a car for like hours, and then you wait 2 weeks to get results back. So it's a real problem.
Yeah, it is unacceptable, right, is what it is. Dr. Kass, I want your thoughts on testing right now. And also something we heard over the weekend, the FDA gave Quest Diagnostics, the lab, emergency approval to start what they're calling pool testing for coronavirus. What exactly is that, and why is it important?
So actually, Andy's totally correct. And that's a way to immediately ramp up testing without having to increase the capacity of the reagents or the facilities by saying we could do, for the Quest Lab EUA, it was 4 tests at one time. And the idea is if you take 4 samples and test them at once and they're all negative, you can then move on, conserving resources. But if one of those tests is positive, you have to go back and, if the pool is positive, you have to go back and retest all 4 samples to find out who the positive test was. Pool sampling is a way to ramp up testing. But remember that this is a reaction to the complicit or explicit agreement that we just do not have enough capacity to test where we need it right now.
Dr. Kass, over the weekend, it was reported that over 80 infants became infected with COVID. How would that be the case? Because I thought the conventional thinking would be, or is that infants may not get COVID or be able to contract COVID.
So I want to be clear what happened in Texas, is what you're talking about, was that there was a county where they were testing children as a part of contact tracing for other positives, kids that came to the ER for maybe other conditions, and they wanted to see, because we don't have a lot of information on children, how many children were positive for COVID while being treated for symptoms consistent with COVID or something else. And they found that 85 out of 100 samples had positive COVID results. It's not that all those children came emergently for treatment or were admitted to the hospital. In fact, they only found one of those children, unfortunately, they've had only one death under the age of 1 in that county in Texas. But that county has 100% of its ICU beds used right now. So the point that this shows us is that if we look for cases, we will find them. We're not making them up. It's just that we're not seeing all the cases that are out there, and especially in children.
Hey, Andy, I want to get back to your article that you wrote this weekend about testing, because you point out that it's sort of a have and have not situation when you look at who's getting tests and how quickly they're getting their results. Talk to us a little bit about that. And also, have you tried to get a test, and what has your personal experience been like?
I'll answer the last part first. I have not. I've just been hiding out here in the woods in Maine, which is maybe burying my head in the sand a little bit, but I've been limiting my contact with other people. We'll see. So yeah, I mean, and this goes back to the early days of the epidemic when, NBA players were able to get tested and none of the rest of us were. And guess what? It's still that way, that it's the haves and the have-nots. If you are an executive at a lab company or in the White House or an NFL player, 72 of them just tested positive late last week, you can get a test and you can get it back pretty quickly. But for the rest of us, no. Now, actually, it's interesting. The rest of us extends pretty high up the food chain, that the mayor of Atlanta, Keisha Bottoms, was unable to get a test back very quickly either. And she got concerned when her husband got sick and still hadn't gotten the results back, and went and got a rapid test in Emory. And then 8 days passed, and she got her first test back. Mick Mulvaney, former White House chief of staff, was complaining that his kids weren't getting their tests back for 8 or 9 days. I said, welcome to the world outside of 1600 Pennsylvania Avenue, Mick, because that's what the rest of us are going through at this point. So that's definitely still out there, the haves and the have-nots.
Yeah, I loved your candor in that piece. Thanks a lot, Editor-in-Chief Andy Serwer and Dr. Dara Kass, as always. Thanks to you both.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.